Well, the war in Gaza has had an enormous humanitarian impact, of course, particularly on children. The World Health Organization estimates that 42,000 people in Gaza suffered life-changing injuries during the war. That figure includes around 10,000 children. That's the estimate from the UN body. And 3,800 children need specialist treatment outside of Gaza. This month, the UN's World Health Organization stressed the urgent need for fuel, medical supplies, prosthetics and assistive devices, and called for medical evacuations to be prioritised. Dr. Zina Salman is co-founder of the non-profit organisation Heal Palestine, who's working with children in Gaza. Very good to have you with us, Doctor. Thank you for taking the time. Firstly, how is the team in Gaza at the moment that you're in contact with, and how are some of their patients?
Thank you so much for having me, Lucy, and for highlighting this very important topic. We have an incredible team on the ground that's been so resilient over the past 2+ years, but they're suffering. We have to be realistic, and they're suffering just like everyone else. When you have a team that's doing humanitarian aid work on the ground in Gaza and they themselves are facing starvation, we have a meeting with them and they say, I'm sorry, I can't respond. I can barely think. I haven't eaten since yesterday. You realize the reality of this. Even the aid workers are suffering. Everyone on the ground is suffering, 100% of people.
And Zina, their patients, the children particularly, hard for them to be resilient when, there's just not the things that are needed to help them get through the hours and the days. I mean, literally.
Absolutely. I mean, as a pediatrician, children's health comes first in my mind. And we've seen a population of children, as you mentioned at the beginning, who've been not only physically injured, but have endured so much, the really unimaginable trauma over the past 2 years. But even prior to that, we've seen children who've lost family members. We have the largest population of child amputees in modern history. So kids who've lost 1, 2, 3, and 4 limbs. We see children who've been displaced multiple times from their homes, and really have seen the unimaginable. And so it's really hard to think of them. They are resilient. They're a resilient population. They shouldn't have to be. No child should have to endure all of this.
Zina, given the level of need that is required, how do you begin to prioritise or assess which children get to be evacuated?
That's really the job of the physicians on the ground who are seeing these thousands and thousands of injured adults and children. At Heal Palestine, we've worked very hard to do evacuations in partnership with the World Health Organization, who's been incredible on the ground. We've brought out 63 children to date. The vast majority of them, but not all of them, are amputees. Many of them have other injuries or even congenital defects or diseases that they don't have access to care for because of the destruction of the health